I have a 45-minute drive in the morning to clinic. During the 45 minutes, I'll listen to podcasts, make some phone calls, I'll listen to music. Then I get to the office, simple breakfast, 2 hard-boiled eggs and some coffee, and now I'm ready to rock and roll in the clinic. I already have patients waiting. I'll see anywhere between 50 to 60 patients in the morning. I have 3 to 4 scribes that follow me around to each room to make sure that all the documentation is done, all the notes for same-day billing. We shoot lots of x-rays in the office to go over patients' post-op surgery so I can go over how they're healing. I see patients from all walks of life. I see pediatric, middle adult, as well as old adult patients. I'll see new patients, post-op patients, in addition to follow-ups. When I'm in the office, I'm very visual with the patients, and I like to show them exactly what is wrong with them. I'll explain things to them, go over models, go over x-rays, and try to be as detailed as possible in layman's terms so they understand. I also do lots of injections, including cortisone, plasma injection, as well as viscosupplementation. We go over their x-rays. I try to explain things to them. Once I'm done in clinic, I head to the surgery center, which is on our 3rd floor of our building. I mark the first patient. First patient goes back and put to sleep. Then I gown up, get ready, get my lead on, get my light on, scrub in, and then head in for the first room. I usually have 2 teams and 2 rooms available that are going. I have 2 anesthesiologists. So once I start my first case, the next patient is already going back and going to sleep and getting prepped. By the time I'm done with my first surgery, I already go into the next room and the patient's already asleep, prepped, and ready to go. I'm very thankful for my OR staff. This is like symphony in the making. It takes a lot of time to train these people that are in the OR with me to make sure they know what's going on. They know what instruments I need. Sometimes I don't even have to ask for it. I take my hand out and the instrument's already there. Now that I'm done with the first surgery, I take care of the paperwork, go see the next patient, mark them, and head back to the operating room for the next case. I do lots of different surgeries in the OR, including fracture work, where I use plates and screws and drills, in addition to arthroscopies, as well as minor hand procedures such as carpal tunnels and trigger fingers. Now that I'm done with the surgery center and I'm driving, heading to the hospital. When I'm on call, I have to go see patients at the hospital. I have to look at the computer, go over their imaging, see a lot of pelvis fractures, bad long bone injuries. But before we go see the patients, we got to get a little food. So we're going to get a little more protein. Now we're going to walk upstairs. I never take the elevators in the hospital. Go see a few patients. Once I'm done, then I'm home. I greet my wife, give her a hug, get a little quick sugar, and then I'm in the gym for about 45 to 50 minutes, and then we have dinner together, and that's the end.